Welcome again, once everybody, to the Mold Wars series, where we talk about controversies in chronic inflammatory response syndrome. We've already discussed different things like lab testing. We've talked about the actual diagnosis of CIRS and how mold plays into that. Today, we're going to talk about how do you actually treat mold in regards to binders. Now, one of the things you have to think about when we talk about mold treatment is removal from the environment is always the first thing you do. You always want to find the source of your exposure, whether it's water damage in the bathroom, whether it's humidity in the air, whether it's the carpet that just is growing stuff that needs to be thrown away, whatever it is, always got to do that first. Could be at work, could be at school. What we talk about today is actually the idea of binders and lipid therapy and some of the controversy there. So that's what our focus is today. The first thing to think about with detoxification of mold is primarily detoxified and the toxins related with mold. Again, I'm referring to the bigger thing when I use this mold term. They're mainly detoxified through your liver into bile and out through your feces, which means you want to use things that maximize this system. And if those of you that are familiar with Dr. Richie Shoemaker's work and Dr. Heyman's work, the biggest and most effective thing is actually a drug called cholestyramine. Cholestyramine is a bile acid resin binder originally developed to treat cholesterol. The second best is Welchol, which is another oral medication used to treat cholesterol. It binds to cholesterol in your stool and makes you poop it out. So what happens is it actually improves the detoxification process of the toxins that are excreted out in your bile. The problem with these things is that as pharmaceutical drugs, they actually have a lot of weird fillers in them. The cholestyramine will have anywhere from sucralose or other artificial sweeteners to sugar alcohols put into them. A lot of people don't tolerate it. Personally, when I was doing some treatment for myself, I tried using the cholestyramine and gave me horrible constipation. Over half the people I work with don't really tolerate these binders. So when we talk about the ideal, that's the ideal. There was actually a study looking at different binders and how they engaged with the bile acid resins. And actually, if you look at number one was cholestyramine, number two was the Welchol, then number three, which was about 25% as effective of those, was actually a combination of okra as well as beet. And so that's the next best binder when you go down the highway of things. Most people can tolerate beet and okra fiber, very easy to tolerate. Okra is actually a great, if those of you who like okra, it's very slimy. It's got a lot of non-absorbable fiber in it. There's only a couple of products on the market right now that actually have that stuff in them. But that's like the hierarchy of binders. The controversy comes when people start looking at other things. This mainly revolves around the urine mold mycotoxin testing, figuring out, do you have Stachybotrys, do you have Aspergillus, do you have Wallemia, what kind of molds are in your body and your stool. And that's when you get in the controversy of using like activated charcoal, clay, alginate, zeolite binders, which do help detoxification, but they're very narrow to those particular mold toxins. And as we discussed before, 80% of the chronic inflammatory response syndrome is actually not the mold toxins. It's bacterial and actinomyces toxins. So if you solely focus on those things, you're going to miss the big thing, which is the actual bile sequestration thing. Now, the big elephant in the room that no one really talks about is fiber proper. Fiber is nature's mold toxin binder. The average American gets less than 12 grams a day of fiber in their diet. You probably need closer to 40 grams of fiber in your body daily. I personally think one of the reasons we have a lot of issues with chronic inflammatory response syndrome and detoxification is because our diets are so fiber deficient. There's actually a great book called Fiber Fuel that actually dives into, it's actually written by a gastroenterologist that deals with why fiber is so super critical for our health. But one of the things that actually helps your detoxification process work better. So what I do now personally is I just try to get that 40 grams of fiber a day to just augment this. If those are familiar with the Shoemaker protocol, as part of that is a cholestyramine and a bunch of fiber to keep your bowels moving. And probably one of the reasons why that is so successful is not just the cholestyramine, but is the mass amounts of fiber, which also feed healthy bacteria in your gut, which help break down the toxins as well. And that's something that a lot of the protocols don't discuss, is how the bacteria in your gut actually improve detoxification. So that's that one aspect of it. So when we start talking about binders, yes, the official CIRS protocol, it's going to recommend cholestyramine, the Welchol. Most people don't tolerate. Then you'll recommend beet and okra, kind of harder to get a hold of. Then there's other binders, but fiber in general is a big part of that. But if you're constipated, that becomes the most important thing. You need to have 1 or 2 good bowel movements a day for your liver detoxification to work appropriately. And the whole bile acid sequestration, detoxification thing, About 95% of all your bile is reabsorbed that your liver secretes into your bowels. So what that means is anything that slows your bowels down a little bit is going to affect that 5%. If that 5% becomes 3%, you've decreased your detoxification probably 40%. It's a big, big change. So just going to the bathroom every day, once or twice, fiber is a big part of that. And that's something to think about. The goal with the detoxification in patients with mold is to maximize the system's working with a minimal amount of symptoms and side effects. Again, the go-to is cholestyramine. I use it a lot. Probably a quarter of my patients tolerate it, and that's where all the other stuff comes into play. But going right to some of the other binders like charcoal, clay, alginate, silica, zeolite, is it's a different world. It's not the CIRS world. It's a different world. The other thing that a lot of people in the traditional mold treatment world don't talk about is lipid therapy. It's now in the CIRS training that's happening through George Washington. I have 2 CIRS training. One's the official Shoemaker and one is the George Washington through A4M. Dr. Heyman's research makes a big focus on lipid therapy and how lipids actually improve detoxification. Now, these lipids are things like phosphatidylcholine, balanced omega-3s, omega-6s, things that decrease the inflammation related to that, which are things like polycosanols, and then using things like TUDCA, torsodeoxycholic acid, ox bile to help the liver and process work appropriately. The reason for this is these things actually increase bile production. So again, binders help the bile get out. But if you make more bile, that's going to improve your detoxification proper. 2, the phosphatidylcholine and the balanced omega-3s and 6s actually help with cell wall membrane and fat inflammation, which is part of what mold illness does. It inflames your fat tissues, your cell wall membranes. So just putting the right kinds of fats in, primarily phosphatidylcholine, primarily balanced omega-3s and 6s. If you lower the lipid inflammation, which is done primarily with things like polycosanols, curcumin, which I didn't mention, and then helping how your mitochondria use those things to burn off the toxins. That's like your torsodeoxycholic acid and your butyrate, which is a big part of this lipid therapy. I've had patients who could not tolerate a single binder, who couldn't tolerate fiber because of their SIBO, and yet they could tolerate phosphatidylcholine and the balanced omega-3 6 orals. And that by itself actually got people's brain fog better and some of their systemic inflammation better because I was still improving their inflammation and detoxification while unable to control the binders. And that's where an individualized approach is huge. You've got to treat the patient where they are, meet them where they're at. I'm trying to think what else we talked about in the podcast. Yeah, so those are the main things that I talked about in the blog post this past week. Hopefully this deeper dive helps people appreciate some of the nuances a little better. If you have any additional questions about that, put them in here as this goes out in social media, as well as on the Facebook and YouTube proper. Because I realize that in order for people to understand this situation appropriately, people need to be educated. They need to get their information, encourage that there are things they can do, and empower people to have the right tools to get to. But ultimately, treatment is simple if understood appropriately and how the mechanisms work. So any additional questions, please let me know. If you want to follow our Mold Wars series, it's on our website. We also have multiple blogs on this topic as well on our website. It's become a very great compendium. We have probably at this stage, when this goes out, probably over 12 different blogs on the different aspects of chronic inflammatory response syndrome from our original series to the other ones. So we've just got a plethora of great information out there to help people get educated about this and treat themselves and their loved ones. Take care. We'll talk to you soon.